NCI-K live here at Citizen Television. We may be smiling, but we're talking about a very, very serious topic, because cancer. You must know someone who knows someone who knows someone who has cancer, or who has died from cancer, or is a cancer warrior. Like we have right here, Evelyn Alela. She has detected breast cancer, and she has fought it. She's a true warrior. And we have three specialists as well. We're going to be talking more about that. Evelyn, first of all, so when you first found out, what went through your mind?
The first thing I thought about was, I'm going to die.
Yeah.
Because for the longest time we knew that cancer is a killer disease. And my family has a history of cancer. I lost my father to cancer of the liver. That's about 23 years ago, thereabout. I had lost a first cousin to breast cancer. So it was like, okay, it's my turn now. But I said, all right, let's deal with this. So I went to, that was now, when the diagnosis was done, my doctors gave me the treatment plan, which I went through. Very difficult, especially the chemo part of it. But I was very fortunate that I had an amazing support system. My family and my friends were really, really there for me. And I cannot overemphasize the importance of having a support system when going through this sort of experience. Yeah. So,
how many chemos did you go through?
I had 8 sessions of chemo.
8?
Yes, I had 8.
And did you lose your hair? Did you, like we always hear all these stories?
Yes, yeah. I lost my hair, I lost my eyebrows, I lost my eyelashes.
But you got them back now?
Yes, I got. Yes, I did.
Well done.
By the time I was done with chemo, all the hair started growing back. Yeah, it all grew back.
Do you feel, you wake up sometimes and say, you know, I feel a pain here, I feel there's something, it may be coming back. Do you get those fears?
Yes. So what happens is, after someone has gone through cancer, whatever another person would think is just a headache or a backache or chest pain, for me, it's, oh my God, could I be having a recurrence on the chest? Could I be having a recurrence on the bone? Was it coming back to the brain? So I always worry when I have any sort of pain or when I'm tired, I'm like, okay, what is this now? So yes, there's that fear that it could be recurring, but we just soldier on and push at the back of the head and carry on with the day.
Yeah. Mheshimiwa, your daughter was 10 years old.
Yes.
10 years old. Very few people think of children getting cancer. When you first heard she was sick with cancer, how did you feel?
Jeff, my daughter was the most healthy baby. Of all my 3 babies, she was the baby who never fell sick at any particular time. So I believe she was the most healthy baby, until one day I was called from the campaign trail by the mother. And she tells me our baby has some tonsillitis that we need to see a doctor. So I told her that's a simple thing, tonsillitis, go to get through that, get checked. So when she went to the doctor told her, you need to see an oncologist. So something clicked in her, and she called me, she told me, what is this? Why should we see an oncologist because of this? So, and to stop everything and come back. So when we went to Nairobi Hospital, and the doctor told us the worst, showed us this baby has cancer.
Oh.
No, the doctor called me and told me, can we take a walk? He told me, Mheshimiwa, this is dangerous, this baby has a problem, this baby has cancer.
Did you try and get a second opinion, or did you?
No, it was so serious then, because within 3 days, the baby could not even, the platelets in the blood were going down within an hour. So we were getting donors at the hospital. Yeah. Every minute we needed a donor, every minute we needed a donor, every minute we needed a donor. So finally we flew to India. We did a bone marrow transplant.
And she found a match?
Yes, the brother donated, the brother had to stop schooling and join us in India. The brother donated bone marrow to her. She seemed to be recovering, but all of a sudden things went haywire. The organs failed. She had sudden all the organs failed at once. So she had organ failure, acute organ failure, and she passed on November, that was on November 5th.
At 10 years old?
At 10 years old, a very beautiful girl.
Dr. Melly, are there many cases of children, or do you see more and more cases of children with cancer?
Well, Jeff, the statistics alarming. On daily basis, many of cancer incidences, cases are recorded on daily basis. Let me confirm to you that the National Cancer Institute of Kenya is the custodian of all cancer data in this country. We have a national cancer registry, and this includes data from childhood cancer diagnostic and treatment centers. They are on the rise. But interestingly, between adults and children would present in a manner that you can hardly suspect, because they would present with the normal illnesses. You've had Honorable Munene here mention that it was tonsillitis. Trust me, that child had been sick for the last couple of years, because carcinogenesis process does not begin, in a month and you become unwell. Yeah. Most likely, the bone marrow is an organ in itself. And acute lymphoblastic leukemias, which his daughter was diagnosed with, interestingly, when diagnosed in a setup where there is the requisite, infrastructure, where we have the right human resource, the right commodities, even without bone marrow transplant in the West, acute lymphoblastic leukemias can be treated with a cure rate of more than 80%. And we've demonstrated, when I began my practice, we had almost 100% mortality rates in acute lymphoblastic leukemias. But right now, at Moi Teaching and Referral Hospital, where I've worked for the longest time before I joined National Cancer Institute of Kenya, we have cure rates of more than 50% over the last 5 to 10 years, because of a program which is dedicated to treating children. And in this country, for us to address childhood cancers, the approach is totally different from adults, because these are guys that you cannot screen. These are people that you need to have high index of suspicion for you to make a diagnosis. So having our healthcare workers to learn how to suspect, so that you don't end up treating a pneumonia or maybe pain in a prolonged time, and ultimately it becomes cancer when it has spread. I want to, reference, in this world, we have 75% of cancers are diagnosed in the West. 25% are diagnosed in low medium income countries, where Kenya is one of them. But unfortunately, 75% of mortalities are in LMICs. What have they got it right that we don't have it here? But allow me to appreciate that so much has changed over the last 10 years in our country. Our government has really invested both in adults and childhood cancer treatments. And we're not looking at only treatment. The most important thing is to make the right diagnosis. Okay,
Dr. Busahal, let me ask you this. Yes. Dr. Melly just mentioned 75% of cases are diagnosed in the West, right?
That's right.
Do they treat that cancer different? And I'm saying this, as a pure layman.
Yes.
Muzungus with cancer.
Yes.
Are they treated do they have different treatment as opposed to us of melanin skin? Do they treat us different, or is cancer cancer?
Cancer is cancer, and the treatment is the same. Whether you are in New York or you are in Mandera, the treatment is the same. We have what we call treatment guidelines, and they are uniform across the world. What differs are the details in terms of access and diagnosis. Diagnosis requires you to be able to define the cancer at molecular level, at genetic level. And then once you identify it at that genetic level, you can identify what is even causing that cancer. We call them driver mutations. And then you can give a targeted treatment for that particular mutation. So if you identify that, this mutation is what is causing the cell to multiply without control, then you can give a target for that particular mutation.
So is our problem
access? Our problem is access to diagnostics and access to targeted therapy. That is where the problem is.
Jeff, after losing my daughter, thinking about children at cancer, I find out as the country moves towards primary health care, that we are training community health promoters who will be in the villages. We really need now the oncologists and the doctors to do a lot of health education. Because as Dr. was saying, you find a baby who doesn't concentrate in school, who is not doing very well at times, a few headaches here and there.
Yeah.
The notion in the village, you can never suspect a baby or take a baby for cancer screening in the Lulo village.
Yeah.
Because it clicks in my mind that once in a while my daughter will come home, she's healthy, but she says, I'm feeling very tired, so she wants to go and sleep. So you find these were signs maybe that we didn't catch early enough. So I find there needs to be a lot of health education on the issue of children, because we have done a lot of education on grown-ups, how to check breast for cancer, how men need to be checked for prostate cancer. But have we educated our nurses, our clinical officers, our promoters on how to detect early signs of cancer in children?
That's a great question.
It has not been a topic.
That's a great question for the CEO right there.
Yes.
CEO, that's a question for you.
Well, we want to appreciate the government of Kenya through the leadership of His Excellency Dr. William Samoei Ruto for this UHC. This has been, great for Ministry of Health. The whole week we've been in Kericho.
Yeah.
And this will culminate with Mashujaa Day celebrations on Friday. We've showcased a lot. And the National Cancer Institute of Kenya has been part of the institutions that have been showcasing and even conducting screening, public awareness in the community. Now, community health promoters who are going to man a PCN, a primary care network, they have cancer messaging, amongst many other information that we have loaded them with. Within those 100 households that one community health promoter is going to, man, we have information on how to prevent. We have information on, and not only cancer, because, cancer becomes a health issue only when you become sick.
Right.
And that is why NCI is in this country to use a multi-sectoral approach. Our risk factors are in the community. Our risk factors are in the environment. As much as we could be having genetic risks, and I do suspect my fellow panelist, Dr. Alela here, they could be running, a genetic lineage of hereditary disease.
Right.
And we have genetic screening now for such patients who are at high risk. But then majority of us, we have to address this thing in the community. If we are to win this battle, Jeff, we will win in the community. We are not winning in the clinics.
It's
however,
machinani.
Yes. However, we still have to treat those who are diagnosed. And remember, investing $1 in prevention, you save $16 in treatment. And as we all know that I treat cancer like terrorism, because it terrorizes your physical body. Your social life is gone. Your psychological life, you lose your mind. You've had a lot of mental health issues related to cancer. I've had patients sitting in the clinic. Sometimes you even break down, as a doctor, and you wonder, especially when you're treating kids, you wonder, oh my God, these little ones, what have they done? They've not even lived life, for them to be diagnosed. Many people have attributed, many myths that people have attributed cancer in adults. Sometimes people think, I have sinned. What have I done? They blame God.
Or you've been
Many
bewitched.
times, bewitched.
Correct.
So many of that. But at this point in time, with the launch of community health promoters, that is going to be strong in creating public education and awareness in the community. The message.
Hold that thought. Yeah. Evelyn, a lot of viewers are asking, what were the signs, the warning signs, when you first found out you had cancer?
There were no warning signs at all. I just discovered a lump on my breast one day when I was taking a shower. And that's when I decided to go and have it checked, because it was big. So I wondered how long it had been there, because I didn't feel it the previous day. So it was like it appeared overnight, but definitely it didn't. I just happened to discover it on that day. So there were no signs at all.
Was there pain?
No pain.
No pain?
No pain.
And how soon after did you decide, let me go and get this checked?
I got a little bit busy, so I had it checked after about 2 months. And so that is when the whole program started. I was sent for the initial diagnostic tests. I had a mammogram done, which of course came back and showed that there is suspicion, and then sent for an ultrasound. Then after the ultrasound, I was sent for a biopsy, which was now the final confirmation because they took tissue and then they found cancer cells on the tissue that was taken out of my breast.
Yeah.
Yes.
Dr. Busahal, look, for us men, we hate going to doctors.
That's right.
You know that.
That's right.
And prostate has become a big problem.
Yes, that's
especially 50 plus or 60, whatever.
Correct.
What should we do? What's the message to men out there? Because, like you were saying, early detection is everything, huh?
Yes.
The longer you wait,
Yes.
the higher your chances you're going to die.
Exactly.
What do you tell men out there?
What I would tell men out there is that men are the most common cancer for which men are at risk is prostate cancer. And prostate cancer can be silent for many years. You know, prostate cancer is one of those cancers that you can stay with and live up to 100 years without ever knowing that you had it.
Yeah.
Yes. So sometimes you can detect prostate cancer early and treat it, but you may be treating a cancer that never needed treatment in the first place. But you can also leave it, and then it spreads and it causes premature death. Yeah, so prostate cancer is an interesting cancer that usually requires individualized discussion. And so what we usually recommend for men is that we encourage them to have some personalized discussion with their doctors about prostate cancer.
Real quick.
Yes.
Every human being has cancer cells in them, right?
That's right, yes.
Right? Everybody has cancer cells.
Yes,
It's
yes.
just that something that triggers them.
Exactly.
Right?
Yes, there is a predisposition to cancer. You see, the cell is always multiplying. What we see as a human being is just an accumulation of very many cells, and those cells are multiplying at a very high rate. And during that multiplication, things go wrong, which can cause cancer all the time. The body has mechanisms to detect when those things go wrong and eliminate those cells.
Right.
The body launches an immune system to early cancer cells and eliminates them. So most of the time, yes, what you are saying is true, that is happening. And quite often, it escapes these checks and balances in the body and develops cancer.
And this is why you're saying the smoking and the alcohol and all
Exactly.
these things trigger.
Before we leave Dr. Ali
Bushman.
on those predisposing factors, I would wish Dr. Ali to enlighten us a bit on the issue of our diets and the use of pesticides in this country. Because I watched a show here another day, a report by NCI-K Foundation, where they say that 70% of pesticides being used in Kenya in agriculture, most of them are bad.
Cancer causing.
Most of them are bad in other countries. You find what happens in Kenya. We have a pesticide bad in Europe, but Europe allows them to continue producing it for export to other countries where regulations are not very tight.
Right.
For example, something like Roundup. If you go to the village, people don't want to cultivate their land. They use Roundup. Roundup is commonly used. But you found in other countries, people have even been compensated for having been traced that the cancer was caused by Roundup. Go to most of our farms in Kenya today, where we are producing fruit and vegetables for export. You found a greenhouse there, you told that greenhouse as fruit for export.
Right.
So we are not using chemicals. But that other one is for local consumption.
Yes.
So that one we are using
okay.
everything. So I would really tell this issue of pesticide.
That's a good
I think
point.
we have been poisoned as a country.
Dr. Melly, that's a good point there.
Well, it is quite challenging. Thank you, Honorable Munene, for bringing this up. You know, we have mapped these risk factors. And from the NCI, in the past year, we have been doing cancer mainstreaming among its ministries, departments, and agencies, because these are areas where all these risks are. If you go to manufacturing, companies, there's a lot of exposure, there's a lot of chemicals. If you go to landmines, if you go to Kwale by the landmines, if you go to our farms, chemicals that we are using. I was in Kericho yesterday, and the rates of acute leukemias, even for adults in that region, is quite alarming. And I've treated many patients from that region. I do suspect most likely it's because of a lot of chemicals by the tea farms. And, you know, we have herbicides that we are using. We are asking, you know, institutions, because if you are certainly having some risk factors, please, if it is possible to avoid. But if it is part of contribution to another product that is unavoidable, we want to protect those who are exposed. But if there are chemicals that have been banned in other countries, I think that question is good to be addressed, actually, through the National Assembly.
Through?
I'm
Vice
taking
Chair.
it back to him.
You're throwing it
Because
back to me. I agree.
we have to enact laws in this country, Jeff, that are going to protect the public. Remember, nobody should die of a preventable disease. And health is a right to every Kenyan. It's enshrined in our constitution.
Correct.
So where there are risks, you know, we have been discussing today the whole day. I had a meeting with civil society organizations. How do we enact laws to control tobacco use in this country? How do we enact laws to curb, you know, through KEBS and through KRA, we have to make sure that anything that is imported in this country must pass the test. If it's going to be used, you know, by proxy, or if it's going to be consumed. He's mentioned about food. Food is the next pandemic in this country, and actually in the world. Yeah, we had COVID. But food, obesity you had is a risk factor. A lot of chemicals that are used in preservation. Let's even talk about fast food that we are using. You know, if you saw the advert that Kenchik has displayed, of course, some of us are not excited with that because you cannot reduce cancer awareness for breast to chicken on the plate.
Right.
Yeah, and we are asking Kenchik that they would have to do something about that. I'm putting on this tie. It's Breast Cancer Awareness Month.
Correct.
You know, we really want to address these things with the seriousness it deserves. Colon cancer, we are eating a lot of refined food. You know, you wondered why more cancer now. We are not eating, you know, the
local
inorganic food that we ate from when we were young. You know, right now we are eating a lot of refined food, and constipation is a huge risk factor for colon cancer, amongst many other risk factors. So on issues that we have confirmed that it's a risk for cancer, we need laws. And National Cancer Institute of Kenya has lined many, you know, suspected risk factors that requires legal, you know, implication. And we're going to have a meeting with our Parliamentary Health Committee soon, parade them, discuss, and these should be bills, these should be motions that should lead to bills, and it should be laws to protect and prevent our people.
Good points. Okay, Mheshimiwa, he's throwing it back to you, and I'll get to you in a moment. I need to take a break right now and come back and talk about that and other issues. I mean, there's so much stacked against us, so much. I mean, we're staring at the abyss here. I mean, we have enough issues, enough problems with, you know, price of fuel and other issues. And now this disease is coming and taking over. I mean, what can be done? What do we tell our people? We're talking to two experts, a legislator and a cancer warrior. That's our topic of conversation. And we're asking you, what is your cancer journey? Let us know at Koinange Jeff at Citizen TV Kenya. Make sure you use the hashtag JKLive. JK Live takes a break. We'll be back in a moment.